Our destiny is not disease, but health, which is a natural condition of life. And for that, we need to develop a proactive attitude towards life, seeking to understand our spiritual nature. But who are we? Where do we come from? And what will be our destination? These are all millennial questions which have plagued mankind throughout the ages, beckoning for answers. When we look at life, we often see it as a series of events. And we often say we are born, we grow, a series of things happen, and then inevitably we die. So death is a part of existence. But the question is, why is the process of death such a source of suffering for some and not for others? According to the World Health Organization, some of the main causes of death are cardiovascular disease, stroke, COPD, diabetes, and depression, to name a few. And medicine has been rapidly advancing in knowledge and technology to help minimize the causes of these illnesses. And yet, all the advances in technology appear insufficient to control diseases and establish well-being. Why are we still suffering? Have we looked deep into the cause of physical and mental disorders that afflict humanity? Scientific evidence has shown that physical and emotional stress are in the root of many illnesses, and that various spiritual approaches are beneficial in restoring health, potentiating conventional treatment, or even preventing disease. But why don't we use these approaches more often? Why are some people so skeptical? What is, after all, the role of the soul, or spirit, or consciousness, or mind? No matter what you call it, this is the essence of who we are, the human being, and that interacts and survives the physical body. Science and medicine are now able to prolong life by managing and treating illness like never before, but still has yet to cure many diseases, and still fails to promote the integral being, encompassing mind, body, and spirit. But why? What or where is the missing link? And if there is a missing link, where can one find it and unveil it and show the true root of our physical, emotional pain? The spirit Dr. Andrea Louise explains in the book Missionaries of the Light that we, a spirit, before incarnating, imprint our spiritual vibration on the genes that will form the new physical body, thus creating a new physiological organism. The World Health Organization has defined health as a state of complete physical, mental, and social well-being. In the medical spiritist paradigm, the human being is a three-dimensional structure composed of the physical body, the subtle body or paraspirit, and soul or spirit. The main target, however, is the healing of the soul or spirit. It is therefore up to the immortal spirit to construct and maintain their own health. Spiritism extends this view and teaches that health is a state of complete bio-psychosocial spiritual well-being because it takes into account the biological, psychological, social, and spiritual factors that influence the human being in its passage through early existence. The new era in medicine shall incorporate a spirit, mind, body approach in order to promote the integral health in its truest meaning. It will understand that we are more than a congregation of atoms. We are a spirit experiencing a temporary existence in matter, and Spiritism offers the key to the relationship between body and soul, proving that one is constantly acting upon the other. This idea opens up a new field in science by demonstrating the possible true cause of certain diseases, thus making diagnosing and curing easier. In the new era in medicine, health practitioners shall address and be attentive to all aspects of their patients' physical, emotional, and spiritual well-being. Compassionate care can be an important tool of one's integral healing and practice. In the new era of medicine, health practitioners shall view the patient as a transcendental, immortal being, where the illness of today could be a result of a cause within the current or past life. The new era in medicine will not only treat the patient's physical body, but will integrate a multi-level approach to restore total health. The health practitioner will not only fix or help with the cure of the body, but also will be a servant of humanity, promoting true healing. As Dr. Rachel Naomi Remen once said, helping, fixing, and serving represent three different ways of seeing life. When you help, you see life as weak. When you fix, you see life as broken. But when you serve, you see life as whole. Fixing and helping may be the work of the ego, and service the work of the soul. Let's embrace and usher in the new era in medicine. Welcome to the 6th U.S. and 2nd International Spiritist Medical Congress.